Hey guys, Dr. Aghayan at Apre. Wanted to announce that we are going to be posting a question box up. So anything that you guys have questions about, whether it's surgical, non-surgical services, about recovery or preparation for surgery, just answer those and we will just knock them out one at a time. But for today, I wanted to talk about something that's a really common question, and that's for patients who are having breast augmentation, whether they need a lift as well. Patients often want to avoid having the lift because of the scars that come with it. And so how do we determine whether it's really necessary or not? The first thing that we evaluate is where the position of the areola is relative to the natural fold or the IMF on the breast. So if it's at that level or below that level, even if you add an implant, it's not going to raise things up. So you're going to have a situation where you have fullness from the implant, but your areola and nipple are at the bottom of your breast and not centered. So ideally, when we're putting in an implant, we want to center that areola on the center, kind of maximum projecting part of the breast. So even though we never want to add unnecessary scars, at the end of the day, shape and contour, in my opinion anyways, outweigh scar. And there's certainly things that we can do to help mitigate scarring with the types of dressing, using a silicone type of either dressing or gel post-operatively, and avoiding sun exposure are all things that will help. As far as scarring goes though, the real answer at the end of the day is it comes down to a patient's tissue and their own biology. Everybody scars differently, and the best predictor of how well you're going to scar is how you scarred before with previous surgeries. Certain areas scar differently, so just because you had a bad scar in one area doesn't guarantee that you're going to have a bad scar, but it at least gives you some type of indication. So look for those questions, guys, and if there's anything that comes up, we're going to be happy to answer.